Welcome to session 26. This is conversations around COVID-19. My name is Kaitlin McNamara, and I work on the Living Well grant at the Wisconsin Board for People with Developmental Disabilities. We're going to be joined hopefully very soon by Tina Wiley, who is a self-advocate leader with the Living Well grant. And also joining us this morning is Sue Urban, who is the clinical director of the IRIS Self-Directed Personal Care Program. So I know you did the language interpretation. I also want to mention that if you are applying for continuing education credits, to make sure your full name is displayed on the Zoom. This session is being recorded, so just keep that in mind. And throughout, we're going to monitor the chat for questions. We really want this to be a space where you can ask us the questions that you have about COVID-19 and finding resources around that. So we're going to talk for a little bit. We're going to give you some information, and then we'll open it up to any questions that you guys might have. So I'm going to turn it over to Sue, and she's going to get us started.
Hi, everybody. Hope conference is going well for you all, even though this is the last day. I've really enjoyed everybody's session. So hopefully this afternoon, you'll have an opportunity to ask any questions you have related to COVID, and also maybe to learn some new information. So I'm going to give some updates and share some information. And like Kaitlin said, we want this to be a back and forth dialogue. So please use the questions, the chat, to ask any questions you have. So anyway, I'm going to share my screen now. You should be seeing my PowerPoint, and we're going to go through some of the updated information that I have to share. So right now in the news, you're seeing a lot of information about COVID booster shots. So that's kind of the hot topic. And at this time, just so you know, Pfizer is the only vaccine that's authorized for a booster, but that is going to be changing rapidly. In the next few weeks, you'll be hearing more on Moderna and Johnson & Johnson. And I'm sure you've heard on the news about being able to mix vaccines. So if you had one vaccine, say you had the Johnson & Johnson, your booster might be Pfizer or Moderna. So there's more to come on that. But right now, what we do know is the Pfizer one is authorized for a booster for those who had Pfizer to begin with. So that's the most current information. So why get a booster? One, it makes your protection stronger if you've had that initial vaccination. So it helps decrease your chance of getting seriously ill from COVID, and it decreases your risk of being hospitalized or even dying from COVID if you get that booster shot. So also, they don't know how long that original vaccine that you received will last. So like the flu shot, this is probably something you're going to have to get a shot annually to keep your immunity up. So that's what we know now. And people are starting to get the boosters. So it's important that you're aware that it isn't just a one and done if you've gotten your COVID vaccine, you still will need to consider getting a booster. And I'm sure they'll be available to everybody at some point. Right now, the booster shots are available for the following people who receive Pfizer. So that you've had to have completed your Pfizer series 6 months ago. And everybody should know, if you've been vaccinated, what date you originally received your last vaccination. So it's 6 months, so a half a year after that or longer. So if you're 65 years or older, if you live in a long-term care setting, if you have health conditions, underlying health conditions, which a lot of us do, and if you're unsure, you can talk to your primary care physician to find out if you do qualify. If you work in a high-risk setting, and we'll talk about that, how that fits in with a lot of people who are at the conference, or you live in, so work or live in. So those are things, again, to take into consideration. I always recommend that people go to the Wisconsin Department of Public Health or the COVID site for the CDC, the Centers for Disease Control, for all your information. There's so many sites out there. There's a lot of incorrect information, but I found the CDC and the Department of Health both have excellent sites and they have the most current accurate information. So it's best not to just listen to anybody on the street or to read blogs or social media posts. It's best to go to the source. And BPDD also has excellent COVID guides and handouts and keeps their information updated. So theirs would be accurate too. So just make sure you're going to a reputable site and you're just not listening to other people and just reading what's on social media. So some group of workers that are eligible to get the booster that are considered high risk are frontline workers. And that means personal care workers or PHWs, caregivers that come into your home. So again, it's something that if they have an increased risk, they should check with their provider too on getting the booster. So they are eligible now because of that, if again, they've had that Pfizer. So I always tell people again, talk to your doctor. If you have questions or concerns, and if you wonder if you need the booster now, if you have to wait, and again, check the websites for additional information. And those are in Iris and Family Care. As soon as we get information, we share it and try to give you the most current information that's out there. So again, something I like to stress, if there's a lot of people still not vaccinated. So if you're not vaccinated, please consider it, especially with us going indoors now, things are getting closed up. Your risk increases when your activities go indoors. So really consider that. That's why cold and flu season is so high in the winter. It's because we're indoors. So it's really important that you consider it if you haven't done so already. And then also continue to wear a mask. Whether you're vaccinated or not, you can still carry the virus if you're vaccinated. You can still get the virus if you're vaccinated. So if you're out in public places, and again, it's winter coming, especially, if you're indoors in a crowd, always wear a mask. And especially if you're indoors at a family event or with friends, and some of them aren't vaccinated. So you should be wearing a mask in your home. I have masks that I work at home, but I have masks that I keep right by my desk. Yesterday, I had a plumber come in the house. So I made him wear a mask. He was trying to come in without one. I said, you can't enter my home unless you wear a mask. And then I keep some right by me so I can put them on if somebody comes in or if I have to answer the door. So just keep that in mind. You should be wearing a mask around people when you don't know their vaccination status, if you're going to be in close quarters. So, and then the other thing is get your flu shot. I know it's a lot of shots we're talking about, but it's important that you don't forget that because you still could get the flu, right? The COVID vaccine does not protect you against that. I just had my flu shot. It's time to get flu shots. I'm sure if you're with MCO, I know people in Iris who have self-directed personal care, everybody's out educating about that right now. I went to my doctor 2 weeks ago and they go, we're going to give you your flu shot today. I'm like, all right. So that's another important thing to remember. And there's flu clinics all over, Walgreens, CVS, those types of places offer flu shots already. So keep that in mind. Oh. And then the next thing I'm going to talk about is holidays. Tis the season, many seasons, many holidays coming up. And after last year, when a lot of us couldn't gather, people are anxious to get back together. Well, with that brings the risk of people coming to events who aren't well, or they maybe feel good, but they could be carrying something. So just remember to think about that when you do gatherings. Some families and friends I know require tests, a COVID test before they get together. So they have a COVID test and then they isolate until the event. That's something people can do. The other thing is make sure if you have unvaccinated family members or people in your family who can't get vaccinated, that you're protecting them and you guys are, wearing masks indoors. Even though that sometimes seems silly if we're around family, it's really important because that's where the spread happens a lot of times, is people say, well, I was at a family gathering or I was at a birthday party and everybody was vaccinated or everybody seemed fine. But it's something to keep in mind, to keep yourself and others healthy is to wear a mask if you're gathered together, or do the testing and try to keep space as much as you can, ventilate as much as possible. Just things to keep in mind. And again, if you're ill at all, don't attend a gathering. Also on the CDC site, it talks about traveling. A lot of people travel to gather at the holidays. They still don't recommend travel if you're not vaccinated. But if you are vaccinated and traveling, you can go to the CDC site for recommendations on how to travel safely, so you don't put yourself or anyone else at risk. And I will tell you, every airline and every country's different. And even in the United States, every state's different. So you do have to check. I'll just share a story. Those of you who have watched me present, I always share a story. But my son lives in Berlin, Germany, and that's a very long way away. And he recently, I hadn't seen him for 18 months, and he recently got to finally come home. And he had to go many places to get here. And he had to get all kinds of testing. And he had to wear, in Germany, they don't allow you to wear just these masks. They have a much stronger mask that you're required to wear, or you have to wear 2 masks. So he traveled on a plane with 2 masks on. So I thought that's pretty good because he has asthma. So I said, if you can travel, I think he traveled a total of 20 hours with all his layovers. I said, if you can travel for 20 hours with 2 masks, I can wear one anytime. So that was, I thought, pretty amazing. But then when he got here, I wanted to rush up and hug him and see him, but I couldn't. He had to get COVID tested and isolate before I could see him because I can't risk getting sick. So he was almost to the finish line. And then finally I was able to see him. And then he stayed long enough and we were able to see each other. And we'll have to do the whole thing again because he's coming home at the Christmas holiday. So, but it was worth it. But I was grateful to him that he followed protocols to keep me safe because I'm in a high risk group. So, and he's in a high risk group because he has asthma and he couldn't go back home if he tested positive. So it was to protect us all and it worked out. The next thing I'm going to cover is talking about masks. I did talk about it the other day if you were at the opening under community resources, and I do have materials out there. But I just wanted to talk about, because I get a lot of questions about masks. First of all, not everybody can wear a mask. If you're under the age of 2, or if you have a disability exemption, because there's some people who just can't safely wear a mask, and that's understandable. But other than that, everybody else can wear a mask. The one I get a lot of times is, well, I have asthma, I can't wear one. I have asthma, I can wear one. That's who should wear it the most, just so you know, because if you have a respiratory condition, you're more likely to get COVID and you're more likely to get very ill from it. So it's more important that you protect yourself as best you can. So you should wear a mask. And that's where the different types come in. But we'll talk about when you choose a mask, make sure that it has more than 1 layer. You have to have multiple layers for a mask to afford any protection. And make sure it's a breathable fabric. So it's not like a hard vinyl. I've seen some in materials that didn't quite make sense. So you want it to be breathable. And if it's a cloth mask, it's got to be washable. And then when you wear a mask, you have to make sure it completely covers your nose and your mouth. How many people see people every day wearing a mask under their nose? I see it all the time at the doctor's office, in the lobby. That doesn't protect anyone at all. So it's pointless to do that. And I've seen them under their chin, all kinds of ways. It's got to be over your nose and over your mouth and not have gaps on the side in order for it to be effective. So make sure that you're putting it on correctly. And then again, fit snugly, not tight, just so there's not a gap. You can't put your fingers in there. And then it has to have a nose wire at the top. If it doesn't, it's not going to fit properly. You can actually buy a peel and stick wire that you can put on the top of your mask, but it's best just to look for masks that have the wire in them. I use two types of masks. I use a disposable mask, and I also use cloth masks. And it just depends on the occasion. I'll have different reasons to wear different masks, but all my masks have that wire at the top, so it's a good fit. So again, don't choose masks that are vinyl, and don't choose masks that have exhalation valves, and I'll show you what that means. And again, you don't need to wear a mask that's what's called an N95. Those are what healthcare workers have, and we don't want to use their supplies. There's reasons you might need to, but by and large, you'll be able to get masks that fit your needs. So here's some masks for people with sensory sensitivities. And the first mask, and you can get these made or you can buy them. They're called duckbill masks, and they look really silly, but they're great if you have anxiety, claustrophobia, or breathing issues, because it allows a big pocket so you can breathe. And I do have some of these on days my asthma is worse, and they really work because I don't even know I'm wearing a mask because it gives so much breathing room. So that's something to look for if you have anxiety. The next thing is a lip reading mask, which is really important. If you're with someone, you have to communicate and they need to read your lips. And those come actually in a washable type, and they come in a disposable type. So that's a good thing to know about. So there's also what I call sensory friendly masks for people who can't stand the feel. You can even make them out of your favorite materials that you do feel comfortable with. And then you can add filters between the layers. So there's all kinds of things you can do. Sense of Calm is a website that specializes in masks that use soft materials that you can check out. And you can also use an alternative face covering, such as a bandana or scarf. Again, if you're using a bandana, you fold it in half, so at least you have 2 layers. So there are things you can use besides a regular traditional face mask that's out there to meet your needs. Now, when I said before, don't use a vented mask, this is what it looks like. Why these are dangerous is it allows whatever you breathe out to go in the air. So if you're carrying COVID, you're spreading COVID. It does nothing to protect other people. And a lot of people buy these because they're all over Amazon, all over websites, and they're really easy to breathe in and out of. It's because the valve is there. And even if it might not let germs in, it's letting them out. So it's not a safe type of mask to wear. I did get this information from the CDC website, and you could go there to find out about it too, but they're just not a safe mask to wear. Also, face shields and goggles. I get this question all the time. Well, if I wear a face shield, then I don't need to wear a mask. And that's not true. All the shield does and all the goggle does is protect your eyes, because a COVID, a virus can enter your eyes. How it affects you is your mucous membrane. So your nose lining, the lining in your mouth, the lining in your lungs and in your eyes is where you can contract a virus. So if you've touched something or touch the surface somebody else just touched, and then you rub your nose or rub your eyes or pick your teeth, you're risking yourself for an infection. But a face shield would prevent a splash of it going in your eyes, but it's not protecting you other than that. So my staff have to wear a mask and a face shield if they go out on visits, if they're around somebody who's not vaccinated or not wearing a mask. So again, you want to wear both, not just one. And how to clean your mask. It's really important. You just don't keep using them. You have to wash them once they get wet or damp, and at least once a day. So I always have 2 masks with me and some disposable ones, just so I'm safe and have what I need. And when you take a mask off, you should be putting it in a plastic bag so you can wash it later or throw it away later if you're using disposable. But you can wash your mask using regular laundry detergent. You can wash them in the sink by hand, or you can put them in the washing machine, either way. And then you can dry them in the dryer, but dry them on warm because that'll kill germs. And if you can hang them outside, that's good because the sunlight will help kill germs. And if you can't, just lay them flat to dry. But you need to wash them every single day. And then if they get wet during the day, you have to change your mask. So those are important things to remember. And always wash your hands before and after handling masks. Again, because there's germs being put in the mask, so you want to make sure that you're not spreading any germs. Next, we're going to review hand washing. And why we do this, it sounds so simple, right? Washing your hands, but it's the number one way to prevent the spread of disease and infection. It's so important to do. And people take it for granted because we have to do it so much. And at the beginning of the COVID pandemic, people were going crazy about it. Now we're still in the pandemic and people have kind of backslid a little bit. So it's really important that you remember to wash your hands the same way every time. And you don't want to use water that's really hot because it can damage your skin. So you want to use comfortably warm water, wet your hands, soak them, and then wash them for at least 20 seconds. And some people, I know everybody knows this trick to sing happy birthday to yourself. And that's the right amount of time to be scrubbing your hands. I don't do that. I just count to 20. And then you rinse. And also when you wash your hands, it's important to wash between your fingers, the backs of your hands, your thumbs, and all the way up mid-arm, like all the way up past your wrists some, and scrub them really good, rinse them really good, and then dry them off. Turn off the water with paper towels if you're in a public restroom or a shared bathroom, and then throw the towels away. Here's some questions I always get because I do home care. It's what kind of soap should I use for my workers, or towels, because paper towels are expensive? Well, pump soap is best because bar soap, germs can dry on the outside. So it is best to use a pump soap. And you can get pump soap as cheap as you can bar soap anymore. So I do recommend you do get pump soap. And then as far as paper towels go, I'm not a big fan of them myself because the environment. So here's what you can do. You use one hand towel for each person in the house, or each worker that comes in has a fresh towel every day they can use to dry their hands. And then those would have to be laundered every day, right? And people shouldn't share those towels because you can spread germs. But in my household, it's just my husband and I, we each have our own towel. And when my son was home, he had his towel. So he had 3 towels hanging up, not touching. But it's still environmentally, that was important to me. I do have paper towels if somebody would get sick or I have an outsider coming to my home. But you can certainly, to save the environment, save costs, use hand towels. And then just make sure each person has their own and that you're washing them. The thing is, then next, if anybody has any questions on hand washing, if not, I can go on, is hand sanitizer, which is probably what a lot of people use because you're out and about. You may be taking a bus, maybe you're walking somewhere. It's easy to carry. You can get it in all sizes. You just have to make sure it's at least 60% alcohol. And hand sanitizer still has to be used correctly to be effective, okay? And it is as effective as washing your hands if your hands aren't visibly soiled. So it's just as good. The thing is, when you use hand sanitizer, you got to use the right amount and you got to use it as if you were washing your hands. So probably about a size of a nickel, unless you have small hands, and maybe a dime size. And you want to rub it all over between your fingers, the backs of your hands, your thumbs, all the way past your wrist a little bit. You want to get it all over. But the key is you don't dry your hands with a towel or on your pants or on the car seat. You have to let them air dry. If you don't, you're wiping away the effectiveness. There's no point in it. So you have to let them air dry in order for it to be effective. And it's alcohol based, so it shouldn't take long to dry. And if it does, you're probably using too much. But I see people all the time put it on their hands and then wipe it off. So you need to do it correctly. So again, put a small amount in the palm of your hand, and then you pretend you're washing your hands to make sure it gets all over. And again, it's the best way to keep yourself safe. So before you eat, when you come in the door, before you put on a mask, when you take off a mask, before you put your fingers in your mouth to brush your teeth or put contacts in or whatever, make sure you're washing your hands and doing a good job of that. And that's not only going to help decrease your risk of getting COVID, it's going to decrease your risk of getting a cold, flu, pink eye, a multitude of things, especially if you're using like bank machines, bank teller machines, or holding on to a lot of handles. Just think about that. And it's also important to keep your hands to yourself, meaning try not to rub your eyes, rub your nose, and pick your teeth. It's a hard habit. A lot of us touch our face continually throughout the day. So it's important to try to remember not to do that. Maybe it's holding on to something to prevent yourself from doing that. But it's just important to think about and try to retrain yourself so you're not doing that. Okay, so that's the end of my presentation. So do we have questions?
I've seen a couple of questions about being scared about getting a booster shot, or being scared of getting a COVID and flu shot. And just being scared of needles and shots in general. If you wanted to just maybe talk a little bit about that kind of fear.
Yeah, and that's, I have to tell you guys, I don't mind giving shots. I hate getting them. It's a big anxiety for me, and I fear it too. I have to, what I call, steel myself up and talk myself into it when I go. And I always tell my doctor, never surprise me. I don't want to come to the doctor's office and them saying, guess what? We're going to give you a shot today. Because I always say, nope, I have to come back because I have to think about it. And it's hard when people have anxiety and you have a fear of needles, but find a support person who can go with you, who maybe will get a shot with you. Maybe it's a caregiver or family member, and you're going to make a pact that if you both get through it, you're going to go get ice cream, go for lunch. I don't know, whatever gets you through it. But I would like to think, and when I went to nursing school, I had to get a lot of shots and we had to give IVs to each other. I didn't like any of that, but I wanted to be a nurse, so I had to go through it. It's tough. And I know some clinics have support things you can fidget with. If you have a small favorite pillow to take with you, anything to help comfort you to get through it. But think about, like, if you didn't get that shot, how you would feel if you got sick. And we've all heard stories about people who have gotten COVID or the flu really bad, and how awful that was, and how it could be weeks or months to get better when that shot and that discomfort is just a very short time. And as far as side effects are very rare with the vaccine. If you read statistics and go to the CDC, again, don't just listen to people or read anything on the internet, go to where the statistics are. And your risks of getting COVID are greater than having a side effect from the vaccine. So I don't know if that helps, but it always helps me to think I'd rather get that quick shot than to be in bed for a long time ill. So maybe try the support person.
And then the other question about vaccines was about the booster and who should be getting the booster, and like who qualifies right now, and when will we know more about other people?
Yeah, we'll know in a few weeks, we'll know more. Right now, who qualifies for boosters? If you are immunocompromised, and you have, maybe you're undergoing chemotherapy, or you have an auto immune disease. And I know both the CDC site and public health lists who is considered having underlying medical conditions that would qualify. It could be that you're older than 65, that alone makes you in that group. Cancer, chronic kidney disease, chronic lung diseases. So if you have severe or moderate asthma, if you have a chronic obstructive pulmonary disease or COPD, if you have cystic fibrosis, if you have pulmonary hypertension or pulmonary embolism, if you have dementia or other neurological conditions, diabetes, 1 or 2, any heart condition, you're considered, if you have Down syndrome, you might be at a higher risk. HIV infection, those are the ones the CDC lists. But again, check with your doctor, because right now only Pfizer's approved. So if you had the Pfizer, you may be eligible for a booster. But again, tomorrow, next week, or the next week, we'll find out more information about that. I talked to my doctor about it when I was there, and I asked her, I do qualify for a booster, but I had Johnson & Johnson. So I have to wait till there's some booster that's approved for me to be able to take one. I hope that helps.
Yeah, and if you find a website that you trust, and I'll put some links to some of the websites we've been talking about in the chat, you know, it's a good idea to keep checking that website, because it's going to have that information updated pretty regularly. Awesome. I think Tina's here, and she is going to share some of her experience with COVID. We're going to move a little bit out of the medical just for now, but if more questions come in, we're happy to take those. But Tina, are you there?
I am here.
Hi, how's it going?
Hi. Pretty good.
That's good. So we wanted to talk a little bit about your experience through COVID. And I know that we talked through some questions. So if you don't mind, I'm just gonna go through those questions, and then you can tell us a little bit more about your experience. Is that all right?
Okay.
Okay, so the first question is, what changed for you when COVID happened?
A lot.
Mhm.
I learned a lot of new things and got a lot of things done when the shutdown came. So
Yeah, so what kind of things were you doing beforehand that are maybe a little bit changed when that happened?
I learned to take more precautions than I used to take. Use a lot more sanitizers, masks, which were the new things. A lot of different things.
Yeah.
Yeah.
So when the pandemic began, did you learn anything new? Maybe not just about like COVID, but did you start a new hobby or learn more about technology, do something that you hadn't done before?
Did a lot of reading. I did a lot of arts and crafts, which I really hadn't done since I was younger. Redecorated my house. Did a lot of reading, a lot of reading on the COVID and where they were going with it. So yeah.
Awesome. So can you tell me what some of the hardest things about the pandemic have been for you?
Trying to keep up with everything. Trying to get a better understanding of what it pertained, and I just went blank. Can I have the next question?
Oh yeah, sure, absolutely. So what kind of questions about COVID, when you had those kinds of questions and trying to keep up with everything, where did you go for your information? Was it somebody that you trusted? Was it, you know, a website, or like who was it that you went to when you had COVID questions?
I was pretty much keeping up with the news because I live by myself. And I really didn't have anyone at the time that could explain it better to me. So I tried to keep up with the news, which was somewhat confusing sometimes. That's how I was keeping up with it. I really
Yeah,
didn't. I
especially at
wasn't
the
able to
start,
get a
it was
lot of.
hard. Yeah, it was
Yeah.
hard to find good information. But now, you know, between the CDC and some other organizations, especially ones in Wisconsin, we're trying really hard to make sure that people have better information and feel a little less scared about some of this stuff, because it's better to talk about it, because that's going to help with those questions.
Right.
So have things changed for you since the COVID vaccine?
Oh yeah. I'm a lot more cautious.
Mm,
A lot more careful. Um, I think I care more about other people being safe, whether from me or whatever. It just made me really think about how, how I can keep others safe just by taking precautions.
right. That makes a lot of sense. Is there something you would want other self-advocates or anybody who's on the call really to know about COVID and taking care of yourself while we're still going through this?
Um, don't be afraid to ask questions. Um, if you can't talk with your healthcare provider or someone in your family or whatever, find someone to talk to. It's very scary when you're by yourself and something that important happens. So to me, it's important to talk with people, to ask questions, to get your anxieties under control, and just take it easy and do what you have to do.
That's really good advice. Are there any other self-advocacy tips that you would maybe want to share with people?
Um, my thing is reading up on as much as you can so that you're able to help others who are in the same situation. That was the main important thing for me, is that for me to be more aware, to be helpful to other people.
That makes a lot of sense too. All right, well, those are the questions that we wanted to make sure that we answered. And I think you can stick around a little bit too. Maybe if there are questions for you that come up in the chat, we can talk through them. I'm going to take a couple of minutes to go through some of BPDD's resources. I'm going to share my screen and take you to our website, and then I'll stick it in the chat so that you can check that out. Give me 1 second here. All right, so this is the BPDD website. It's just up here at the top, this wi-bpdd.org, and I'm going to stick it right in the chat. And this has a lot of information, but I want to focus on our COVID information. So right at the top of the page, you can click on COVID-19, and it's going to take you to this page. It's got lots of resources on it. We have a COVID-19 resource toolkit. It's got a lot of different, both flyers of information that you can read for good, just good resources, but also some things that you can fill out to help make sure that you're safe in your home, that you have what you need, that you can have good conversations with your doctor about things that you may need to stay safe. So I really recommend that if you haven't checked that out, you do so. It's in the process of getting redesigned to be not necessarily just COVID specific, but there is a really good COVID version that we're going to hang on to while we're still working through this pandemic. It's also got a lot of flyers, standalone flyers that help talk in plain language about things that are going on around COVID. So whether that's personal protective equipment, the vaccine, booster information, we have those kinds of things listed here on our website too. And we do that in English, in Spanish, in Hmong, and in Somali as often as we can. If it's not on our website in one of those languages, it's probably because we're updating it, and then we're going to put it out again as soon as we're able to with the best information. Like Sue was saying, we learn things, all the time. And so sometimes we have to update it and it has to go through this process, but we try to do it as quickly as we can to make sure that the most number of people can get the resources they need as quickly as possible. So like I said, here's some more of those forms that I was talking about. My Safe Home Plan, my health form, knowing my rights during COVID-19, the most up-to-date information about the vaccine that we have. All of those things are available on this website under COVID-19. And we also have a playlist of our Living Well Wednesday videos where we talk about not just COVID-19 most up-to-date information, but also all kinds of other things that have been impacted by COVID-19, whether that's, what to do at your job, how to stay safe when you're out in the community, what kind of rights that you have both in your home and out in the world. We talk about changes to the Medicaid purchasing plan. We talk about the best ways to stay connected using technology and how to be safe online. So if you're interested in that, there's a whole playlist of those videos as well on our website. I'm going to scroll back to the top, and I just want to go to one other page, not the COVID-19, but just under it is one called vaccine information. And that is going to have, hopefully it'll load, there we go. That's going to have some of our flyers about the vaccine. We have one where it's a lot of addressing the fears that people might have about getting the vaccine if they haven't yet, and we will update it with information about boosters as we get it. It's got some helplines that you can call. You can call our office, but you can also call the Wisconsin COVID-19 Vaccine Help Assistance Hotline, and they might be able to answer your questions or direct you to the right person who can answer those questions. They can also help you set up an appointment or find you an appointment and help you register for it if that's something that you are still looking to do. We also, like I said before, we also have plain language vaccine information. Those are all listed here. They have information for family care, for IRIS participants, and for CLTS. So if you're in any one of those programs, you've got a program-specific sheet with good information about getting the vaccine. And again, those are listed with all of our different languages as well. So I'm going to stop sharing my screen. I just wanted to be able to go through a couple of those resources for you. And again, like I said, if you have any questions, BPDD is a great resource. You can give us a call. We'll help find you the right person to talk to if we're not it. The CDC is a really great website that's going to have a lot of information, the most up-to-date information that they can give you about COVID vaccine and what's going on in different states and all that kind of stuff, travel advisories, all those kinds of things. So I'm going to take a peek at the chat now because I think we've got some questions coming in and I want to make sure.
Yeah, and Kaitlin, I would like to add that the BPDD handouts are, like you said, they're in plain language. They're super easy to understand. And the toolkit is fantastic. I get a Tri-Counties newsletter from an organization in California, and theirs is like nothing compared to the work you've done on that. And it's really fantastic. We're lucky to have that resource. Really helps a lot of people. Yeah.
That's really important for us to know. And we are always taking feedback too. So if there's something that people are looking for that we haven't addressed, we'll get that information. We're going to get it out to you as quickly as we can, because we want to keep as many people safe as possible. Let's see. So I know that we're getting some questions about talking to people who haven't gotten the vaccine or are having some trouble believing the information that they're being given about COVID. So I don't know, Sue, if you had anything that you wanted to say.
Yeah, I saw it was from my friend Martha. Hi, Martha. Yeah, that's a tough one. And what happens is there's all the time we all have like family members or know people who either don't believe COVID is real or don't believe the hype or afraid to get vaccinated or whatever. You know, we all have to care for ourselves, right? And we all try to protect others. So that's all we can do. I have a family member I won't be around because they won't get vaccinated, they won't wear a mask. I don't have great health, so I won't be around them. And I haven't, and it's sad and it's hard, but that's my hard line. I can't risk my health. So, I mean, I don't think you're going to force someone, even with all the information out there, if they haven't educated themselves or don't buy in or believe at this juncture, they probably never will. So I just go by, what do I need to do to stay safe? And that's a choice that I made, is just not to be around people who are going to put me at risk. So.
Yeah, and I think you can definitely be compassionate and understanding that where they're getting their information from is informing how they're seeing this situation. And that's really hard because you want them to be safe too. So you can be really understanding and respectful, but it's important to have a good boundary for yourself that puts your safety at the forefront, at the beginning of any kind of decision that you make, because you can talk to them and be encouraging to them and share the good knowledge that you do have. But at the end of the day, you know, we want you to be here with us and participating in things like the self-determination conference. And so you're going to have to make some hard choices sometimes to put you first and your safety and your health. So it's hard, but it's going to be really, really important. We also have a question about COVID sticking around. How much longer are we going to have to be in this situation, do you think?
Yeah, that's a big question that no one knows the answer to. You can go by what science predicts, is that as long as people aren't getting vaccinated and won't wear masks, it's going to keep sticking around. Unfortunately, how a vaccine dies out is that everybody's either getting vaccinated, you garner what's called herd immunity. That means most people are vaccinated, and it kind of dies out. But because that didn't happen, we're getting what's called mutations. So we're getting different types of COVID that's going around, just like the flu. Every year they try to predict what strains are going to be out there. So when they create the vaccine, they create it for the strains that are most likely to hit. I foresee COVID kind of being like that. Like every year, along with our influenza booster, we'll be getting COVID shots for the foreseeable future. Does that mean it's going to be as severe as it is now? Hopefully not. Over time, it won't be, because already there's been a lot of hope and change, right? The more people are vaccinated, the more people we can be around. So that's been a big shift this last 6 months. So hopefully it'll continue to improve. But I don't see it just totally being what's called eradicated or totally being wiped out in any short time. But there's nobody who has that crystal ball who just knows what's going to happen.
Yeah, it's just something that we're going to have to be aware of. And as we've learned, you know, there are really good ways that we can stay safe, even if it is something that is part of our new normal for the foreseeable future. It doesn't mean that we will never be able to go back to some of the things that we were doing. It's just that, you know, this is going to be one of those things that we have to be aware of and probably will be for some time, which means all of these resources are still really important things to access and to know about. I think even, you know, remembering that we have to keep washing our hands, we have to keep using hand sanitizer correctly. Those things are going to be important no matter how long COVID lasts. So just refreshing our memories on those kinds of things too is really important.
Can you, somebody said, how did the Spanish flu go away? It really didn't. It's what we call influenza now. We created a vaccine for the flu. So the Spanish flu is what we call the flu now. It's just kind of evolved into our yearly flu season. So it never went away. It's just called the flu now.
Yeah, and that's true. Like, you know, pandemics are things that come up that and especially as we live in such a interconnected world, it's something that may be surprisingly a little bit more frequent in our lifetimes. And that doesn't, you know, there's no reason to be extra afraid, even if it's not COVID and you know, there's something else that happens. It just means, you know, we know really good information about talking about these things, doing the social distancing, wearing masks when it's appropriate. You know, we're going to be well prepared for, you know, if it's influenza or COVID or something else. You know, we've learned some really good information in the last 2 years now, and we're going to be able to take that forward into the rest of our lives too, no matter what kind of medical situation comes up.
Yeah, that's a good point. We've come a long way and we're all going through it together. There's nobody who hasn't been touched by this. So we all have that in common. So in ways it made us stronger and more resilient in a lot of ways.
Yeah, we all have something that connects us now. We've all experienced the learning curve, the Zoom fatigue, the remembering to take your face mask everywhere, all of these things now that we have in common with one another that we maybe didn't before. I'm seeing some comments and some questions about not just holidays, but other kinds of activities, vacations, sporting events, that kind of thing. Are the same rules do they sort of apply to all of those situations as well?
Yeah, I mean, I always weigh out, again, I'm at higher risk. So I just don't go to, I don't go to crowds. I don't go to parties right now because that's my choice. But if you're gonna go somewhere, you just have to know your risks and protect yourself. You know, it's an individual choice. And again, you keep as safe as you possibly can, but then you know that it could be a risk, right? But if I have people who've gone to weddings, and again, they've required you to be vaccinated ahead of time, or I've heard about people going to sporting events where you had to be vaccinated. But check ahead, understand the size of the crowd, find out about spacing that they have, and then with that education, right? Education is power and information is power. Then you have to make that decision for yourself, because nobody can say it's safe. This is safe or that's safe, right? It's as safe as you make it. So check that out. A lot, you know, family gatherings, you know, it's the same as any gathering, right? It's just you have to decide spacing, what you're gonna risk, what you're not gonna risk, who's gonna be there, all that kind of stuff. It's a lot of decisions to be made.
I did put the CDC's coronavirus or COVID-19 website in the chat. One of the first things that's on there is a link to conversations about the vaccine booster. So if that's something that you are looking to get some more information on, that's a really good place to start. And then, like I said, I put the link to BPDD's website there as well. You can also follow us on Facebook. Anytime we have new information, we try to post it on our Facebook page. So that's another good place to stay connected to us and find out what's going on around COVID and what that means for people with disabilities. We've got a couple more minutes, so just 2 or 3 here. So if you have any other questions you want us to answer, feel free. Also, you can reach out to me afterwards. I think my email is part of the presenter list, and we can make sure that your questions get answered if you think of them later too.
Yeah, it's all evolving, as you guys know, every day. I try not to watch the news too much, but I always watch the first 10 minutes of the Today Show because it'll tell you when there's COVID updates. And then I'll go to the BPDD or the Department of Health or CDC to follow up. Those are the only sites I go to, and then find out the information I need to know without oversaturating and over worry. Like what's changed. And you're right, there's so much information out there. Just please don't go by what's on Facebook. Don't go by people are telling you at your local church or community group as much as you are looking at those sites, just because misinformation gets out there, then it gets passed, and then people have the wrong information. So the best thing again is to go to those sites, get the right information, educate yourself, and then make a decision.
Yeah. And I think that's a really good point too. I think that, like, pick your resources, stick to those. That way you can think about things that are not just COVID. I know we're all a little bit over it too. So, make your decision about what you trust and what you're going to listen to, and keep yourself updated, but then give yourself a break to not think about it all the time, because
Absolutely.
You're going to know the information that you need, and then you get to have a break as long as you're keeping yourself safe.
I agree. That's good advice.
Well, thank you so much for joining us this morning. And I want to thank Tina, and obviously thank you so much, Sue, for talking with me.
Yeah, thank you. Thanks, everybody.
Thanks.